All right, welcome folks. So glad to see everyone. As folks are continuing to trickle in, we wanted to get started with our mindfulness activity for today. So for today, I'm hoping that you might have a small object, any small object nearby that you could pick up and hold in your hand. So it could be a pen, a piece of paper, a paper clip, doesn't really matter what it is. As always, you're welcome to leave your camera on during mindfulness or turn it off, whichever makes you more comfortable. And we're going to do a, an observation exercise today. So I'd like you to hold your object in your hand, and then for the next minute or so, use your senses to just engage with the object in whatever way you'd like. So you might look at it, you might describe how it looks in your mind, you might feel it, you might smell it, you might hold it up to your ear and see if it has a sound. And I'll give folks a moment. As your mind wanders, just do your best to bring it back to your object and your five senses. All right, you can go ahead and bring your attention back. Thank you for engaging in that. So without further ado, welcome again, folks. We're really glad to see you. As always, we love to see faces. So if you're in a place where you can turn on your camera, thank you for doing so. And we understand that that's not feasible for everybody. Thanks so much for joining today. So I'm thrilled to introduce our speaker, our very own Dr. Lauren Haack. She is a licensed clinical psychologist who consults with families and providers of school-age children and adolescents. She's been, since 2007, she's been specialized in the conceptualization, assessment, and treatment of individuals with inattention and disruptive behavior conditions such as ADHD. She also has expertise in cognitive behavioral strategies to manage anxiety and depression. Dr. Haack is passionate about mental health capacity building in schools, primary care settings, including efforts to support providers in the identification of psychiatric symptoms and related impairment, utilize practical and culturally informed language pearls with youth and families, and integrate evidence-based time-limited strategies such as single session consultation. And Lauren is an associate professor here at UCSF. So thank you so much, Dr. Haack.
Thank you, Lindsay, and thanks everyone for joining us in what is, I know, a very challenging time for a lot of us, as well as the families we work with. We are going to just spend a moment kind of acknowledging that today, and we wanted to kind of respect all of your time and continue with the programming that we had scheduled to kind of try to keep that balance of moving forward in the important work that we do. So today we will be talking about, in the first half of our hour here, resolving problem behaviors and helping families break the cycle. And then in the second half of the hour, we'll move to case-based learning. So we'll kind of all brainstorm together about a framing question that somebody brings to the group. So this may be old news for some. Just in case, though, we wanted to highlight that we do have a new name. We're the same service. We used to be called CAP. We're now CalMAP, to reflect the statewide expansion. As always, PCPs are welcome to call our warm line to get specialized consultation from a psychiatrist or psychologist on our team. And we have other education series that are ongoing, such as our monthly webinar series, where all the recordings are also available on the website. We also have a school-based series, Echo series, which happens on the second Wednesday of every month at 2:30, and we have the PCP Echo series. So please feel free to visit our website to get more information about that. Here's just if you want to snap a QR code for the consultation. And here are some of our upcoming CME offerings, the webinars, the PCP Echo on trauma and PTSD. The next school Echo will be on racial trauma and discrimination in ACEs. And then our next therapeutic skills Echo will be on distress tolerance. We don't have any disclosures of interest to report, but we do want to acknowledge our funding as always. And just in light of everything that's going on right now, we do want to, restate our mission and values, which are unchanging, that we're promoting pediatric mental health and wellness through consultation, education, and resource navigation. And we really value equity, inclusivity, diversity, partnership, interprofessionalism, prevention, and stigma-free access to care for all. And so, in light of these, ongoing mission and values and what's happening right now, we did want to kind of curate some resources that folks here might find helpful, or you might want to pass along to others. So we have this toolkit. It's basically a working library of resources that we have. There's currently resources in English and Spanish for LGBTQ youth, as well as for undocumented youth and knowing their rights. And then we also have some resources on there about surviving wildfires, and should have more resources being added all the time. Also, if anyone in this room has resources that you want to share with the group, please feel free to put them in the chat. We are all really here to learn from one another and get through this time with collaboration and support. All right, so switching back, our focus today for the next 20 minutes or so are going to be, how can we learn this antecedent behavior consequence, or ABC system, and apply it to specific youth and families you're working with to give them support? How does this model connect with some systems that we have, like the PBIS model at school? And then how can we identify two effective antecedent and two effective consequence strategies that can be helpful to coach families on, aligned with this model? Okay, so you might be hearing ABC model, antecedent behavior consequence, and think like, wow, that sounds, odd. That sounds like something a psychologist does maybe, but really everyone in this room, I guarantee you, has already been using ABCs, right? It's really taking a look at what is the behavior that's happening, and how can I change or coach my families to change something that's preceding the behavior that happens before, and what's happening after, so that I get more of the behavior I want to see, right? So when you do your homework, then you can play video games. That's a really simple example of an ABC. Okay. So these are sometimes called functional behavior analysis, or before-after plans. I like to call them before-after plans when I'm working with families, because it just sounds simpler. And so when you're doing this tool, the first thing you want to do is really help the family narrow in on what is the specific behavior that they're worried about. When they're in your office, like, what's coming top of mind that they're concerned about. And it's really helpful if you can coach the family in being descriptive and not judgmental, right? So like, let's say they come in and they say, well, my kid's out of control. Like, I don't really know what that means, right? Like, my out of control definition might be different than yours. Like, it's hard for me to really gauge what that is, right? So if I can coach the family towards being more specific and descriptive, well, every time I give them a direction, they ignore me or they talk back. Okay, we all kind of know what that means, right? We're not guessing, we're not putting a label on why it's happening. We're just saying, this is, if I was writing a screenplay, that's what the director would see and know how to coach the actor to what to do, right? So once we narrow down what is that behavior, we think about, well, what's the opposite behavior, the goal behavior that we'd want to see, right? Well, I would like my child to follow the instruction the first time, or with one reminder, right? We want it to be realistic, right? I might want to say, well, I want them to just do it every time without any reminders. Well, if you're giving like 10 reminders right now, it might be more realistic to start with having some reminders built in. And then once you have that goal behavior narrowed down, you want to think about, well, what's happening right now before the behavior and what's happening right after? What are those antecedents, the setup, the setting, and what are the consequences? And when we say consequences, a lot of times in our mind, that connotates something negative, right? But really, we're just meaning, what is the result? What's the response that is happening that is making the behavior more likely to continue, right? So what's the setting for giving the instructions? Well, usually my kid is doing something they want to do, like watching TV or using their screens, and I ask them to stop and do something they don't want to do, like get ready for dinner, right? That's the setup. And what's the result? Well, I tell them again and I tell them again. I sometimes get angry. And you know what? Sometimes I just like give in and say, whatever, this isn't my fight. I'm going to fight tonight. Right. Well, it makes sense that that response is making the behavior more likely to continue. Right. So then what do we want to do instead? How can we change the setup? Well, maybe we have really clear rules about what time screen time goes on and off. And maybe we have a set consequence, a set positive reward that they earn when they follow the directions the first time. Right. So if the rule is that screens go off at 5 o'clock so we can transition to dinner, every time you comply with that rule, well, then you get to earn a little bit of free time after dinner. Right. And again, rewards are much more powerful than punishments for a lot of reasons. You're less likely to bankrupt yourself, or you kind of run out of negative consequences, right? You've taken away screens for the rest of their life. Well, I don't have anything to take away anymore. And also, we like people who give us rewards. We like people who give us positives. We have contention, and we don't really want to work as hard for someone who's constantly criticizing us, right? Okay, so we can also kind of, a lot of times when children or teens are showing problem behaviors, it's not only happening at home, they're hearing about it at school, right? And sometimes this is even more concerning to the parents, right? They keep getting calls home from school, there's threats, they're going to get suspended. And so, what you can actually coach the parents to do, or if you're able, you can work directly with someone in the school to do, is help them identify what are the problem behaviors happening at school, what's the setup and the response, and what are some goal behaviors we could set for this child, and how could we change what's happening in the environment and maybe set up some rewards that are either earned at school or even at home if the teacher can communicate with the parent how they did in the day, so that we can get those goal behaviors more likely to happen. Okay. And so we can ask the teacher or ask the parents to talk to the teacher about tracking the behavior that's happening, make a list of kind of what are they seeing before those behaviors that might be triggering those behaviors, and then what are maybe some unintended reinforcements, right? Like maybe when the child is disruptive, all the other kids laugh, right? And so they're accidentally getting rewarded for that problem behavior. Right? And then we're going to help the school setting kind of identify how could they make simple changes, switching their seat, right? Using a little bit of a planned ignoring, or even setting up some rewards. What do folks think in this room? What are some other ideas for how this example family could kind of work with the school to set up different antecedents and consequences to make the disruptive behavior less likely to happen, and instead make respectful behavior, rule following behavior more likely to happen? Feel free, anyone, to unmute yourself or put thoughts in the chat.
You could use peer pressure sometimes and like have a whole classroom reward system that when we have a day where it's peace and calm, that, they get a token, and when we get certain tokens, then we get a pizza party.
I love that, Shelley. And sometimes teachers may be more on board with those kind of classroom-wide systems because they feel like, well, it's not like I'm putting all these extra resources into just this one student, right? And yet it could help with this particular student's behavior. Any other thoughts? Yeah, change their schedule. Sometimes that's a really easy change, right? Like, are we having their most challenging subject at the end of the day when like their attention is totally gone? Could we work in some more breaks? Really clear definitions of what is the expected behavior, right? So instead of just saying like, stop goofing around, like, what do we want them to do? Have it labeled on a paper, on a chart, where the teacher could make some discrete little tally marks. When they see that expected behavior, they can reinforce it in the moment, give labeled praise, and then maybe even kind of communicate to the parent, hey, you know, so-and-so had a great day at school today. They followed directions, you know, most of the time. And then they could earn free time at home, for example. Yeah, maybe put their paper on the desk. Love it. See, you all are experts. You all are doing ABCs all the time. And if we think about who in this room, kind of like show of hands or reaction, who's familiar with the positive behavioral interventions and supports system at school, or PBIS? Okay, only a couple people. The reason that we bring this up is because schools kind of have their own language, right? So just like we have our own language in healthcare, I'll tell you, psychologists certainly have our own language, that we love acronyms for everything, right? Schools have their own language, and schools are motivated to kind of do certain strategies if it fits into these systems that they receive funding for, that they are really encouraged to do by administration, right? So PBIS is one of these multi-tiered systems of support. Other people might have heard that phrase too, the MTSS. And basically what it does is it separates out what are strategies that schools can do that are universal. They're going to benefit everyone, like have school values of being respectful. What are tier 2 strategies that we do for like a group of students that maybe need a little bit more support, right? Like maybe we're going to do some screening. Maybe we're going to have a lunch bunch group for students who need help with social skills. And then tier 3 are like where we're really getting targeted individual programs. Usually these are reserved for kids who have designated IEP or 504, or well, really IEP plans. 504s are usually more tier 2, but if this student is needing something like an individual targeted behavior plan and tutoring, and they go to groups, right, that's more like that tier 3 level, right? And so Shelley's suggestion about setting up a classroom reward system, that's an example of a universal system of support, right? Like certainly it'll hopefully help our student, but it's something that would be beneficial for the entire classroom to have these expectations and rewards, right? And so this language can be nice when if you are coaching families to advocate for support at school, or if you're able to directly talk with the school, so that you can kind of, you know, use the language and say, oh, and by the way, this strategy that I'm suggesting is actually universal, you know, PBIS tiered system of support. Or they might come back to you and use that language, and you can kind of, you know, have that ascribed credibility of not being like, oh, I don't know what that is. Here's another look at what are some different strategies that we could put in place in an ABC plan, right? And kind of where they fall on those levels of support, right? So an antecedent maybe for the child paying attention or following directions in school might be, you know, having those expectations really clearly defined, right? Having the reward system would be a nice consequence. With the tally system that somebody mentioned, that would be more like a tier 2 where we're really doing more progress monitoring, right? And so again, this functional behavior analysis, or this ABC plan, really fits nicely into this school framework that schools should really be familiar with, and again, motivated to work with you on. All right, so when we're doing these ABCs, what do we want to do? What are some tips and guidelines? Again, we're really trying to state reasonable and achievable expectations, right? So when you're, you know, working with a family, you know, think about what's the child doing now and what's maybe one step closer to what we want to see, rather than expecting perfection, which might be too big of a jump for that kid right now. Somebody mentioned a visual paper chart that can be really key, right? Especially if a child has attention problems, right? To have this visual reminder. And that also creates less room for this verbal back and forth, which can get parents and kids into this kind of contentious negative cycle. How can we just make these expectations routine so that the child knows that they're happening at the same time, in the same order, the same place every day? There's less arguing and negotiation about it. And as much as possible, pair with rewards and praise, right? And sometimes I talk to parents about, like, think about, what motivates you to get work done, right? Would you go to work if you didn't get a paycheck? Like, I love what I do and I wouldn't, right? Like, that's we all need those rewards. Also, think about a boss that gives you a lot of praise versus a boss who just criticizes you all the time. Like, who do you want to work with? Who do you want to show up and be your best self for?
Lauren, can
And
I
then
ask
we
you
do,
something?
yeah, absolutely. Please,
If,
Shelley.
if you go back to the other slide, one of the things I think that I reflect back one more is that the school system, okay, when you go to an IEP and there's behavior problems, they enlist a behaviorist to do a functional behavioral analysis. So they're like detectives and they analyze all of these ABCs. And then they come up with some strategies and plans. And then how do we take that as primary care providers to help out our families who are dealing with difficult behaviors at home or at school? Is we encourage them to be the detectives of the ABCs and kind of have to kind of do their own analysis to figure out strategies. And I like to tell families, you got to write these down and you have to be strategic because, once you set up your reward plan, is that reasonable? Is that going to be achievable to keep doing? And my partner and I have to check ourselves all the time to make sure we have a good plan in place before we roll it out. So I just wanted to kind of say how we interpret, like, yeah, okay, you got a psychologist or, school psychologist doing this ABC. How am I going to do it as a parent? It's doable. But that's the coaching.
Thanks, Shelley. That's a great point. So one thing that might kind of happen as part of this ABC functional behavior analysis process at school, or something that might not happen that you can help the family advocate for, is a behavior support plan at school. And behavior support plans can also happen at home, right? And so really, what does that mean? We can break it down simply into 3 steps. Our first step is we just want to establish what we call SMART goals. And many people here may have heard of SMART goals, but this is specific, measurable, attainable, relevant, time-limited goals, right? So I have a 3.5-year-old, right? So if I think about, I'm not going to tell her be good, right? Like, I want to be really specific. Okay, you are going to follow your nighttime routine with 2 reminders, right? That's really specific. I have her routine down. She knows it's brush your teeth in here, put your jammies on, books and songs, in bed, right? That's pretty attainable. My 3.5-year-old can do 4 steps with a couple of reminders, right? And it's really relevant to me as a parent. Like, that's a big deal, right? That's motivating for me to get her in bed without a big fight every night. And it happens every night, right? This isn't this sort of unending, very abstract goal, right? And then how do we establish rewards and pair with praise, right? So my daughter knows that if she does her routine and follows the directions without too many reminders, she gets 2 books and 2 songs, right? And that's really rewarding for her. There may be a time, I'm sure that that's not going to be the same reward when she's 16, right? So we're going to have to shift up what those rewards are to keep them fresh for her and keep them motivating for her. And really, I think a super helpful coaching to give to your family is we want to aim for 5-to-1 ratio of praise to correction, right? Because this is sort of a magic number in terms of what we know keeps kids motivated to keep working towards their SMART goals instead of being discouraged, right? And this is especially helpful for kids with attention and behavior problems like ADHD, because their brains are actually hardwired to perceive and attend to negative feedback and not attend to positive feedback. So you have to really be conscious about having more praise than correction, because they sort of are extra focused on that correction. And then monitor and tweak as needed, right? Hopefully, when my daughter is 10, right, I don't have to give her every single direction verbally, but maybe she just knows automatically this is my bedtime routine. And again, the reward is probably going to be something a little bit more age appropriate. I don't know. Maybe she'll still want books and songs. We'll see. Now, sometimes people hear behavior plans and it sounds really like, ooh, I don't know, I don't like the sound of that. It sounds punitive. But actually, when these are done right, they're trauma informed because they can be resilient focused, right? They're focused on these SMART goals we know that they can achieve. When we have clear expectations and structure, it actually helps us feel safe. It helps us feel secure. We've gotten some questions from our folks around California, you know, who are impacted by the wildfires, and they've been saying like, should we be like doing the same things with our kids in terms of like having them go to school and having, you know, chores at home? And actually, even though it might be our kind of instinct to like pull back and not make our kids do these things when they're having times of stress, it's actually really helpful. It makes us feel safe and secure if things are happening as we expect them to. And then again, it provides the sort of roadmap and setup for kids to be getting reinforcement for these behaviors we want to see. When we're doing these, you know, some considerations, we want to be consistent and understanding, right? So if my child just had a really, really hard day because of something that's happening in the world, right, I might want to be a little bit more flexible, right? But I don't want to completely throw everything out the window. We want to be confident and also respectful, not too punitive or authoritarian. You want to do these in a way where you're being genuinely yourself, but also being a role model, right? I want to make sure if the rule is no screen time for my kids, but at dinner time, I don't have my phone out at dinner time either, right? And then whenever is possible, provide choices, right? Okay, well, right now it's time for bedtime routine. Do you want to start by brushing your teeth or brushing your hair? Like, notice both choices are choices I want them to do, right? But by just giving them the choice of the order, it gives them a sense of agency and limits when needed. So these slides are available to you if you want to use this actual slide as an ABC plan in any of your visits. You can also just do this on a whiteboard or a piece of paper. But I find it to be really helpful to actually visually map it out with families so that they can take it with them or take a picture of it on their phone because it helps it be really concrete. And I promise you, this is something that you can do in as few as 10 minutes and can be really impactful. Questions, thoughts before we head into the case discussion? Well, I see there's one in the chat.
Yeah, Darcy had a good question that was, can we run through a little bit what to do when a child does not follow through with the plan, knowing that positive rewards work better than consequences?
That's a great question. So if you have a reward system in place and the child doesn't earn their reward, it sort of is like a consequence, right? But it's all in the setup and how you frame it, right? So instead of saying like, that's it, you've lost screen time, if they know that the only way that they earn screen time is by doing their homework, and if they don't follow through with the consequences, then they don't earn their reward, that still falls in line with these recommendations.
So it sounds like you might respond and say, okay, you didn't follow your nighttime routine, so there's going to be no screen time tomorrow after school.
Yep. And then it's most helpful if we can keep them in the same day so that then tomorrow is like a new day and they're motivated to do their behaviors, right? Because that's what we don't want to do, is we don't want to sort of bankrupt ourselves where they're like, well, why would I even try at school today? I don't get screen time when I come home, and that's the most important thing in my entire life, right? Another thing that we can talk about is like, let's say they've earned a reward. Like, let's say they get a reward for how they do at school, but then they do something at home that's like really egregious. And you're like, ugh, like you still want to give them their reward. You don't want to take away something they've already earned, but you could delay it, right? Okay, you know, because you just, you know, disrespectfully talked back, like we're going to delay your school reward from 4 o'clock to 5 o'clock. Okay, just give you time to reset. in when, then versus if. Absolutely. I love that point, Shelley, right? So it's really telling them like you're in control of if, when you earn this reward. Any other questions? All right. I will turn it over to Lindsay then to walk us through our case-based learning.
Thank you so much, Dr. Haack.